Today, we are going to look at a BodyViz brain builder about hiatal hernias and then walk through a case study example. A hernia occurs when fatty tissue, an organ, or part of an organ pushes through a weak area in the abdominal wall or diaphragm. There are several types of hernias, including epigastric hernias, hiatal hernias, inguinal hernias, umbilical hernias, and incisional hernias. Hernias can be uncomfortable, but they are treatable with the right care. In this brain builder, we will learn more about the symptoms, causes, and treatments of hiatal hernias. The diaphragm is a dome-shaped, three-part skeletal muscle that separates the thoracic and abdominal cavities. Its outer edge is made of skeletal muscle, while the center consists of tendons from the surrounding muscles. The diaphragm is made up of three different sections of skeletal muscle. The vertebral portion has its origin on the anterior surfaces of the first three lumbar vertebrae and their intervertebral discs. The sternal portion originates from the xiphoid process of the sternum. The costal portion originates from the lower six ribs and their costal cartilages. All three sections merge and insert onto the central tendon of the diaphragm, which attaches to the inferior surface of the pericardium. The diaphragm has three major openings that allow structures to pass between the thoracic cavity and the abdominal cavity. Hiatal hernias affect the esophageal opening. The esophagus, both vagus nerves, and branches of the left gastric artery and vein all pass through this opening. The esophagus is a muscular tube that carries food and liquid from the oral cavity through the diaphragm and to the stomach. Externally, the stomach has the following segments. The cardia is where the esophagus connects to the stomach. The fundus is the top portion of the stomach, located superior to the cardia. The body is the largest part of the stomach and features two curvatures, the greater and lesser curvatures. The pylorus is the narrow inferior segment, which is divided into the pyloric antrum and the pyloric canal. In a hiatal hernia, part of the esophagus and/or stomach pushes through the diaphragm's opening into the thoracic cavity. Hiatal hernias can be congenital, but most develop later in life as the esophageal opening in the diaphragm weakens and widens. There are two main types of hiatal hernias: sliding hernias and rolling hernias. In a sliding hernia, the more common type, an upper segment of the stomach and lower part of the esophagus slide up into the thoracic cavity through the diaphragm's esophageal opening when a person lies down or bends over. When they return to an upright position, the stomach and esophagus slide back down into the abdomen. In a rolling hernia, the junction between the esophagus and the stomach stays in its normal position. However, the fundus of the stomach rolls up through the diaphragm's esophageal opening into the thoracic cavity, positioning itself anterior to the lower segment of the esophagus. Most people with a hiatal hernia don't feel it or notice any external bulge in the thoracic or abdominal regions. The symptoms associated with hiatal hernias are primarily related to chronic acid reflux, also known as gastroesophageal reflux disease, or GERD. GERD occurs due to the abnormal positioning of the stomach and esophagus in a hiatal hernia, leading to the upward flow of gastric acid into the esophagus. Common GERD symptoms include difficulty swallowing, burping or regurgitation, sore throat or hoarseness, heartburn, especially after eating, chest pain not related to heart issues, nausea and shortness of breath, pain in the lower chest and upper abdomen after eating. While most hiatal hernias aren't severe, they should be monitored by a doctor to prevent complications that could cause pain or permanent damage to the esophagus or stomach. Diagnosing a hiatal hernia is typically accomplished through testing, such as X-rays and an endoscopy of the esophagus. For minor hiatal hernias, the common treatment is to wait and watch. If the hernia worsens, medications may be prescribed to manage GERD. Surgery is rare and only considered if symptoms are severe, unresponsive to treatment, or if there's significant damage. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 31. Sex, male. Chief complaints, persistent heartburn, occasional regurgitation of food, difficulty swallowing dry food. You invite the patient into your office for an examination. Your patient reports his symptoms have been troubling him for the past 6 months. He has tried over-the-counter antacids, which give him temporary relief, but the heartburn becomes worse when he lies down after eating. He mentions that he often wakes up with a sore throat and sometimes feels like food is stuck in his throat as well. You perform a physical examination and do not notice any visible bulges in his thoracic or abdominal regions. The patient denies chest pain or shortness of breath. You ask about his eating habits, and he mentions he tends to eat large meals in the evening and frequently lies down immediately afterward. Based on his symptoms, you recommend further tests, including an upper endoscopy to check for signs of a hiatal hernia or esophageal damage, and an X-ray to assess the position of his stomach. The results of these tests confirm the presence of a hiatal hernia. You advise your patient to make several lifestyle changes. Avoid large meals in the evening, stop lying down right after eating, raise the head of the bed to help prevent acid reflux at night. Additionally, you prescribe a proton pump inhibitor to reduce acid production and manage his GERD symptoms. You schedule a follow-up visit in a few weeks to evaluate his progress and discuss further management options. If symptoms do not improve, further interventions, including medications or possibly surgery, may be considered. This has been a classic example of a hiatal hernia. Thank you for watching this Brain Builder video. Please like and subscribe to our YouTube channel, and if you're new to BodyViz, check out our other anatomy resources and schedule a demo today at bodyviz.com.